What happened that kind of led up to you being diagnosed? Like what kind of symptoms you were having and what was going on in your life?
Boy, well, basically, I was having like panic attacks at work, small ones, okay? And you know, I didn't realize what it was. I let it go. Didn't seek any medical help or anything. And one day, I sort of went into a blackout. I kind of was supposed to be at work by 9 o'clock in the morning. For some reason, I wound up on the streets that day. And my wife was concerned. She went to look for me, but they found me about a week later. I was in a complete blackout. And I don't really remember, and the police got me. They said they made sure I was okay, and they took me to a hospital. And I spoke to the doctor about it, and I just had no recollection of, I was still wearing the same clothes, no money, I hadn't eaten, all kinds of stuff. I was really bad off. And my first hospital stay, I stayed about a week, and they medicated me, and slowly I started to respond and come back to regular. So that's about it. I didn't feel that schizophrenia was part of my life. I rejected it. Well, after my wife left me, you know, she took my kid, and I was left alone. She, you know, in an apartment I couldn't afford. There was no paycheck coming in, and I was considering in deep thought about what the doctors were telling me after the second hospitalization, and I don't know, within a month after the second episode, I came to terms, and I realized that I have to be on medication and to survive, you know?
With Keith, for Keith, he actually was diagnosed at a later age, and his treatment would also occur at a later age as well. And there's also, during that time, he did not take any medications. There's a lot of non-compliance. But his prognosis is still very good. What he lacks from the other patients I discussed was the family support. But what we can give him now is that if he continues to take the medications and to continue to show the improvement, that there's other type of support that can be provided for him.
Other symptoms I have, I hear voices. Some are, you know, they're basically negative. You know, they say I'm a loser and I'm no good, and sometimes they tell me to hurt myself. You know, other times I think about hurting somebody else. But you know, the medication suppresses most of it. But sometimes I have real problems, and I have to get away and just be by myself when I'm having some serious symptoms, you know.
I do see a significant improvement in Keith from the time I first saw him. When he first came in, he was talking to himself. He was responding to internal stimuli, and now the voices are much improved. He still has some thoughts about some paranoia, some general paranoia, and he still has a lot of some negative symptoms and some cognitive symptoms. But overall, he's making a huge progress, and he knows that he's making progress with that, and he understands that he needs to continue to take these medications.
I've been on this medication almost 2 years now. You know, if I go to like a grocery store, I usually used to time it when I know there's only a few customers in the store. There wouldn't be long lines. I have the ability to take the bus again. You know, for quite a while I get disturbed. I mean, I get paranoid and thinking, you know, it's a big crowd and nervous. You know, but today I can.